Hi, so welcome to this presentation. My name is John Yambut, and I will be presenting on this project titled Identity and Capabilities Brochure for a Community-Based Diabetes Prevention Program here in San Angeles, Texas. So this is part of the paper submission for the Program of Development for Improved Outcomes. So the purpose for the brochure will be to provide a clear, accessible information about the health program and raise awareness and encourage participation, build trust and engage the population, and also showcase the program capacity to address diabetes type 2. So here, what I'm saying is this brochure serves as a communication to raise awareness, like I said before, and encourage participation and showcase the program's capacity to address type 2 diabetes here in San Angeles. So, what is a community-based diabetes prevention program? As highlighted, it focuses on lifestyle interventions to reduce type 2 diabetes and target underdeserved rural populations and emphasizes education. So, Um, the program operates through workshops, group support, and health screenings, aiming to reduce new cases of type 2 diabetes. So, the guiding principles here, we're talking about the mission, which is empowering communities through education and preventive care. We talk the vision is that a healthier, diabetes-free future for rural populations. And here we see that the mission and the vision reflects the program's long-term goals, community engagement, and public health focus. So what we offer here, like we talk of free community health screenings, lifestyle workshops, nutrition and exercise, access to trained health coaches, family engagement. All of these services are tailored to the community's needs, emphasizing prevention rather than treatment. So who do we serve? Here we talk about the target population, adults from 30 to 65 years who are at risk for type 2 diabetes. So we serve rural underdeserved communities in San Angeles and we focus on education, low income and high risk groups. So understanding our audience helps tailor our messages and services effectively. So working together here, we work in collaboration. Here is talk about partnership. We work in collaboration with local clinics and hospitals here in San Angelo. The hospital groups, that is the large hospital groups, is Shannon Healthcare. They have clinics and local health centers, and they have hospitals. We also work in partnership with schools and communities. We have the Angelo State Universities. We also work with the public health department and NGOs and some other private institutions like Encompass Rehab Hospital. So these collaborations enhance outreach, service delivery, and credibility in the community. So result that matters, we're talking about evaluation here. Okay. Now, um, this improved health literature. Okay. When all of this is done, we see that at the end, there will be an improved in health literacy. People will be aware of diabetes type 2. People will know how to implement the preventive measures. We also see that there will be decrease in BMI and blood glucose level. People will be able to monitor their blood sugar, BMI, we're talking about basal metabolic index. So people were able to control their blood sugar because of the awareness that is created. So all of this is done using the model after the CDC National Diabetes Prevention Program that came up in 2022 and was revised in 2024. So the program is grounded in evidence and aligns with the national public health strategies. So getting started here, how do we implement this program? To say we enrolled participants through online and in person, like we talked before. We have workshops and outreach. We also have programs scheduled in specific locations and we provide transportation and accessibility. So we ensure that accessibility by removing the barriers to participation, especially in rural areas. Nobody should complain that there was no means to come. You can stay at the comfort of your home and register through and enroll through online. Communicating effectively. Here we're talking about reaching the population, cultural values, language, all of that. You see, so in the southern part of the US, like here in Texas, they are mostly Spanish-speaking population and English-speaking population. So we make sure that our materials are in English and in Spanish. We also make sure that the language of communication is simple and clear, and we respect culture, values, and traditions. So we see that cultural competence is vital to gain trust and ensure effective communication. Also, this is achieved by involving the communities. Reaching out our audience, we prepare flyers, we go to church events, social media, and local radio. We go to local radio and give talks on the local radios. We have peer advocates and community health workers that get involved into this program. So we see that multi-platform outreach helps connect with diverse segments of the target population. All of this put together, we know how this population with the social media and everything, it makes it easy for them to get involved. Measuring success. Participant feedback surveys. Here we make sure that we get feedback from those who are involved in the program, health outcome tracking, grant support, and long-term planning. So ongoing evaluation ensures effectiveness and support funding continuation. So we always evaluate, re-strategize, and so we'll be able to continuously have fun to continue the program. So, in summary of the key topics of this brochure, we talk about the mission, the services that we offer, the target population, the partnerships, the accessibility to the program, and all of this is evidence-based impact. We saw that it will improve health literature and all of that. So, this brochure reflects a comprehensive, community-centered approach to diabetes prevention. Thank you so, so much.